Good morning, student. So, in yesterday lecture, we was learn about the diseases of the lacrimal apparatus. Firstly, in that we see the anatomy of the lacrimal apparatus. That is, this is the lacrimal gland. This is the lacrimal duct. This is upper canaliculus and this is lower canaliculus. This connect and become a common canaliculus. This is a and it open into the lacrimal sac, and which lacrimal sac is continue as a nasolacrimal duct and open in the wall of Hasler. So this is the structure of the tear film, that is a lipid layer, aqueous layer, mucin layer and membrane glycoprotein with the microvilli. Then we studied about the dry eye, that is, it is the not a disease entity but a symptom complex occurring as a sequelae to the deficiency or the abnormalities of the tear film. This is then its etiology, signs, symptom and treatment. Then next topic is the watering of the eye. As we learned yesterday, that is watering of the eye is characterized by the overflow of the tear from the conjunctival sac. The condition may occur either due to the excessive secretion of the tear, that is hyperlacrimation, or may result from obstruction to the outflow of normally secreted tears, that is EP4. Its etiology, and then we study the important topic for the clinical point of view and exam point of view, that is the dacryocystitis, that is the inflammation of the lacrimal sac. It may be congenital, that is primary, acute and chronic, and secondary dacryocystitis, that is mostly seen in the infant and in adult. This is all about the dacryocystitis. This is a diagrammatic representation of the acute dacryocystitis. That is, it is a stage of the lacrimal abscess. So, in this diagram, we can see how there is an inflammation of the lacrimal sac, which lead to the dacryocystitis. That it is an acute inflammation of lacrimal sac. This one is a dacryocystitis diagram. In that, how we can see how there is a swelling and pus formation in the lacrimal sac. Then this is the stage of the external lacrimal fistula. In the acute dacryocystitis, after there is a swelling and pus is a drainage, then there is a formation of the lacrimal fistula. Then is etiology, pathology, signs and symptoms. This is all about the acute dacryocystitis. In this, there is a secondary dacryocystitis. We was learned yesterday its treatment and chronic dacryocystitis. After that, we was learned yesterday that is the swelling of the lacrimal gland, that is the dacryoadenitis. In that there are two types. First one is a acute dacryocystitis, acute dacryoadenitis. That is the swelling of the lacrimal gland. Its etiology, clinical symptoms, signs. This is a presentation of the dacryoadenitis in which a patient with a bilateral dacryoadenitis shows the S-shaped curve of the upper eyelid. So, in that we can easily see how the dacryoadenitis is occur, and there is a S-shaped curve of the upper eyelid. Next is a chronic dacryoadenitis, that is, it is characterized by the engorgement and the simple hypertrophy of the gland. Etiology, clinical feature, differential diagnosis and treatment we was learned yesterday. So, from the tomorrow, we will learn about the tumors of the lacrimal gland. So, the tumor of the lacrimal gland is also an important topic in the lacrimal diseases, in which there are not so common and in a simplified way can be classified as big. So there are the many types of the tumor of the lacrimal gland, in which first is lymphoid tumors and inflammatory pseudotumors. So, the tumor of the lacrimal gland, lacrimal sac, are extremely rare and represent a potentially life-threatening condition. That is a carcinoma of the lacrimal sac. And most neoplasm are the squamous cell carcinomas, traditional cell carcinomas, and adenocarcinomas. So, the triad of malignancy are a mass below the medial palpebral ligament and a chronic dacryocystitis that irrigate freely and regurgitation of the bloody mucus. Last is a dacryocystography shows a filling defect. So, when a triad of malignancy is occur, then it shows that a mass below the medial palpebral ligament. Second is a chronic dacryocystitis that irrigate freely, and third one is the regurgitation of blood mucus. So, the dacryocytography shows a filling defect. So, the tumors are not so common and in simplified way can be classified as below. That is, first one is a lymphoid tumors and inflammatory pseudotumors. In that, these constitute approximately 50% of the cases. So, the 50% of cases shows the lymphoid tumor and inflammatory pseudotumor. Second one is the benign epithelial tumor. These include a benign mixed tumors which account for the 25% cases. So, the 25% cases shows the benign mixed tumors. Last is a third one is a malignant epithelial tumor. That is, these also constitute the 25% of the cases and include a malignant mixed tumor, adenoid cystic carcinoma, and mucoepidermoid carcinoma and adenocarcinoma. So, the malignant epithelial tumor is also constitute 25% cases and it consists of malignant mixed tumor, adenoid cystic carcinoma and mucoepidermoid carcinoma and adenocarcinoma. So, firstly, we will learn about the benign mixed tumor. So, it is also known as a pleomorphic adenoma and occur predominantly in the adult male. So clinically it represents as a slowly progressive painless swelling in the upper and outer quadrant of the orbit and displacing the eyeball downward and outward. It is locally invasive and may infiltrate its own pseudocapsule to involve the adjacent periosteum. And histologically, it is characterized by the presence of pleomorphic myxomatous tissues, just like a benign mixed tumor of the salivary gland. So, it is known as the pleomorphic adenoma and occur predominantly in young adulthood. And it represents slowly progressive painless swelling in the upper and outer quadrant of the orbit and displacing eyeballs from downward to and out. So it is locally invasive and infiltrate own pseudocapsule and to involve the adjacent periosteum. So it involves the adjacent periosteum. And histologically, it is characterized by the presence of pleomorphic myxomatous tissues, just like a benign mixed tumor of the salivary gland. So, treatment of the benign mixed tumor is that it consists of a complete surgical removal with the capsule, and recurrences are very common following the incomplete removal. When there is an incomplete removal of this benign mixed tumor, the recurrences are common. And so there is a complete surgical removal with the capsule is required for to remove or to treat completely the benign mixed tumor. So this is a down and out displacement of right eyeball in a patient with the benign mixed tumor. So the patient shows that how there is a downward and outward displacement of the eyeball in this right eyeball with the benign mixed tumor of lacrimal gland. Next one is a malignant mixed tumor. Malignant mixed tumor is a life-threatening condition. It occurs in older age group as compared to the benign mixed tumor, and it presents as a painful swelling of the short duration. Histologically, area resembling a benign mixed tumor are seen along with the adenocarcinomatous areas. So, the benign mixed tumor it occurs in the older age group as compared to a benign mixed tumor, and it represents as a very painful swelling of short duration. And histologically, the area resembling a benign mixed tumor are seen along with the adenocarcinomatous areas. So, the malignancy triad shows when there is a mass below the medial palpebral ligament, a chronic dacryocystitis that irrigate freely and regurgitation of the bloody mucus. And dacryocystography shows a filling defect. So treatment is that if by complete excision of the sac followed by the eradication. So this is all about the malignant mixed tumor, that is treatment is to remove the complete excision of the sac followed by irradiation. So, after the tumor of the lacrimal gland, we will study about the homeopathic therapeutics for the diseases of the lacrimal apparatus. So, firstly, in that we can study that for the dacryocystitis, in the homeopathy there are many remedies are useful like Apis mellifica, fluoric acid, pipersal, iodine, Mercor, petroleum, pulsatilla, silicia, and the stannum mate, and duct closed from exposure to the cold. So, when the patient is exposed to the cold, there is a closure of the duct, that is lacrimal duct. So, calcarea carb is useful in that case. And when there is a duct stricture, the nitrum mud is useful in a stricture of the duct. And when the lacrimal duct is swollen, then we can think about the graphitis and the silicia. For the epiphora, there is a calcarea carp, graphitis, hypersulf, murk salt, nitrum silicia, and tongo are, can be useful. And fistula lacrimalis. For the fistula lacrimalis, there are the many medicines. That is, in the lacrimal diseases, when there is a stage of the external fistula is appear, then we can use a calcarea carb, causticum, fluoric acid, lachesis, mercur, nitromur, nitric acid, petroleum, phosphorus, phytolacca, silicia, stannum mate, and sulfur. So this is about the homeopathic therapeutics for the diseases of the lacrimal apparatus. So we can see in detail that about the Apis mellifica. Apis mellifica, it is a common name is made up of from the honeybee. The tincture is made from the live honeybee and is but little stronger than the 3x trituration of the APM virus, which is made by extracting and by triturating the poison cell. So the leads are much swollen, pale red edema with the upper one hang like a sac. Conjunctiva is inflamed, edematous with the dark red veins, and there is a lacrimation which is a hot. So agglutination is also seen in the Apis mellifica. which subjectively the patient feels that there is a itchy, stinging, and sharp piercing pain in and about the eyes with the burning, stinging, which causes the lacrimation with the soreness and smarting in the eyes. So the lid edges and canthi are swollen with the fullness, photophobia, eyes pain are easily fatigued, and there is a sensation of the foreign body. So vision of the apice is obscured, difficult with the whirling, and there is a pain on using the eyes. So when there is a using of eyes, that when he open the eyes there is a pain. And characteristics is that there is a thirstlessness, even with the fever and drowsiness. There is edema, dropsy, skin is a waxy and white. So thirstlessness is the characteristic feature of the apis. Even in the fever also, there is a thirstlessness, drowsiness, edema, dropsy is seen in the apis mellifica patient. With the clinically, it is used in a blepharitis, corneal ulcer, erysipelas, staphylomas, then after suppurative inflammation,
नंतर
albumin,
येऊन गेली.
rhinitis, and useful in the various form of the keratitis with the purulent edema. And as a rule, there is a temporary from applying a cold water, an extremely valuable remedy in the inflammatory affection of eyes and always characterized by a serious exudation, edema, and sudden piercing pain. So next one is a Calcarea car. Calcarea card is a very deep acting and chronic remedy in the homeopathy which shows that there is a swelling and redness of the lid which are sensitive to light and blepharitis with the lacrimation in open air and early in the morning. So there is a spots and ulcers on the cornea. Lacrimal duct close from exposure to the cold with the easy fatigue of the eyes. Farsightedness, itching of the lid, swollen, chronic dilatation of the pupil, cataract, dimness of vision as if looking through a mist, then it is useful in the lacrimal fissure. So, when we study the lacrimal fistula, we think about the calcarea carb is one of the most important remedy in the cases of the lacrimal fissure and worse by the exertion that is mental or physical and better by the life. So this is also a characteristic feature of the calcarea cow that is worse by external, mental or physical exertion and better by the life. Next remedy is a causticum. Causticum patient shows objectively that what we see in the patient is pupil dilated, visible twitches in the lid and left eyebrow, with the eyes are inflamed, lids are red, there is a lacrimation in the open air. And subjectively, the patient feels that there is a pressure as if sand were in the eyes. There is a dryness, photophobia, burning and stinging with the inflammation and the pressure pain in the eyes by the touch. With the inclination to close the eyes, they close involuntarily and there is a sensation of heaviness in the upper lid as if he could not raise it easily. And vision is indistinct and dim. So there is a dim vision is seen in the causticum. We when clinically we studied the causticum, peripheral paralysis of the muscles, that is the levator palpebris superioris, orbicularis, then external rectus and ciliary muscles, that is it is useful remedy for the peripheral paralysis of the eye muscles. And causticum is principal remedy for the ptosis and paratic aphonia, that is after the post diphtheria. Then next remedy is the fluoric acid. Fluoric acid is an important remedy in the cases of the diseases of lacrimal apparatus. So The hydrofluoric acid is a common name of the fluoric acid. Subjectively, the patient feels that there is a sensation as if lid were opened by the force and a fresh wind were blowing upon them. And after that, feeling of a sand in the eye which felt inflamed. So, clinically, these symptoms have often been verified in various eyes disease. So, the fluoric acid is useful in the case of dacryocystitis. As we see that fluoric acid is useful in dacryocystitis and also in the fistula lacrimalis. So, this is useful in dacryocystitis and fistula lacrimalis. Next remedy is graphitis. So, the graphitis objectively, the patient shows that very inflamed lid margin. There are the dry mucus in the lashes with the canthi are cracked and bleed easily. So externally, the canthus inflamed. There is a morning agglutination with the thin excoriating mucopurulent discharge and lacrimation with the redness of the whites. And subjectively, graphitis shows that there is a photophobia intense in daylight rather than in the artificial light. So, light dazzles the eyes and sensation of the dryness in the lid and the pressure. So, there is a heaviness of the lid and heat about the lid. Heat, burning, biting, smarting in the eyes with the vision of graphitis is that vanishing of sight during the menstruation. There is a flickering when writing letters run together and appear double. So there is an appearance of the double vision is seen with the letters run together. These are seen in the vision of the graphitis. And clinically, a very few medicines are so frequently called for in a chronic marginal blepharitis, in chronic inflammation of the lid, cornea, conjunctiva, and in scrofulous subject, particularly when there is a intertrigo or eczema characterized by moist cracks which bleeds easily. So, graphitis is also useful remedy for the diseases of lacrimal apparatus when there is a external canthi is inflamed and morning agglutination with the thin excoriating mucopurulent discharge and lacrimation. So, the next remedy is the hypersulfureous, that is the hypersult. Objectively, the patient shows that there is a upper lid are red, swollen, inflamed with the pressive pain and morning agglutination with the inflamed eyes, whites red, profuse lacrimation, spasmodically closed lid in the morning. And subjectively, the patient shows that there is an intense photophobia. Eyes pain are very painful or ache. And in bright daylight, if he attempts to move them, the eyeballs are very sensitive to touch. So, pains are sore as if bitten, pressive, throbbing, shooting, and smarting pain in the external canthus with the hardened mucus and pressure in the eyes as from the sand. So, when we can learn about the hippolysis is a very important characteristic and sensitive remedy useful in the diseases of lacrimal apparatus when there is a leads are red, swollen, inflamed. and pressure pain with the morning agglutination, and inflamed eyes with the white red and the profuse lacrimation, with spasmodically closed lids in the morning. And subjectively, the patient feels that subjective symptom is what the patient feel internally, that there is an intense photophobia, eyes are very painful, that we can't see that his eyes is painful. The patient told us that my eyes is very painful, there is aching pain in the bright daylight, and he attempt to move them. So eyeball is a very sensitive to the touch, with the pains are bitter and pressure. So this is the characteristic feature of the hypersal pain, that there is a bitter, pressure, throbbing, shooting, and smarting pain. So these smarting pain in the external canthus with hardened mucus and pressure in the eyes as from a sand. So there is a sand-like pressure in the eyes that he feels that. And vision shows that there is an obscuration while reading, dim sight by the candlelight, blindness on rising and standing after sitting bent over, with the field of the vision reduced one, and continual movement of the bright circles before the eyes. So object looks too large. Thus, the hypersal patient feels that object looks are larger than what is present, and there is obscuration while reading with the dim sight of the candle, and there is a blindness on rising and standing after the reading, and field of the vision reduce one. So the characteristics of hyperself is that there is a oversensitiveness of the nervous system. Hence, the extreme sensitiveness to the touch, to cold air, and to cold application is seen in the hyperself, and the sensitiveness makes the subject irritable and with the hasty speech and action. So, the oversensitiveness of the nervous system is a very characteristic feature of the hypalsa, where there is an extreme sensitiveness to the touch, to cold air, to cold application. We cannot bear cold in any, and sensitive makes the subject irritable. So the irritability comes due to the sensitiveness, that oversensitiveness is seen in the person, which lead to the irritability with the hasty speech and action. So there is this hasty speech and the action is very hasty. Clinically, the Hipar is useful in the blepharitis, keratitis, phylacticular inflammation of the cornea, corneal opacity, and one of the most frequently used eyes remedies with the acute phlegmatic inflammation, and there is a pustule and ulcerative keratitis with the great sensitivity of the symptom, and the deep slugging corneal ulcer with the hypophobia. So it is useful in a corneal abscess, keratitis, and cataract or the purulent conjunctivitis. So also with these diseases, Hipasub is useful in the diseases of lacrimal apparatus when there is inflammation of the lacrimal sac. So it is useful also in a dacryocystitis, dacryoadenitis when there is a fistula. So it is useful in the lacrimal fistula. Next is iodine. So iodine objectively shows that there is a sclera is a dirty yellow, eyes are protrude and lids are edematous. So eyes inflamed as from taking cold. So there is a aggravation from the cold. So iodine is also like a hypersol shows the aggravation from the cold. With the sclera is a dirty yellow, eyes are protrude, and lid are edematous with the eyes inflamed as from taking cold, and subjectively pain as from the exfoliation. So there is a Although a ravenous eater, the patient is painfully thin and the patient loves cold air and feel better in it. So patient characteristic shows that iodine patient loves the cold air and feels better in the cold, but eyes are inflamed as from taking the cold. And although the patient is ravenous eater, there is a very much eating habit, or he is a ravenously eater patient, but it is a thin. So there is a digestive problem is seen in iodine cases. Clinically, iodine is to be thought of for acute exacerbation of the chronic inflammation. So, any case of chronic inflammation which shows the acute exacerbation, we can think about the iodine. Goiter, exophthalmic goiter, catarrhal conjunctivitis, acute dacryocystitis, the bluish red inflammation extend under the eye. So iodine is useful in acute dacryocystitis when there is an acute exacerbation of the chronic inflammation of the lacrimal sac. The late Dr. John F. Gray recommended for the acute phlegmonous dacryocystitis 6 drops of compound tincture of iodine in 6 ounces of water a day. So he given the dosage of the iodium, that is how we can use iodine in the cases of the acute dacryocystitis. Next remedy is mercurius. So mercurius is also chronic and constitutional and the defect in remedy in the homeopathy. Objectively, the patient of the mercurius shows that there is a upper lid are thick, red, like a sty, and eyes are inflamed with the swollen tarsi and very sensitive to the touch or light, and lids are spasmodically closed, so there is a acrid lacrimation and a morning agglutination. So eyes are forcibly drawn together and inflamed swelling in the region of the lacrimal bone. So there is a inflammation of the eyes and swelling in the region of the lacrimal bone. Then subjectively there is a photophobia, that is the gas light, and intolerance of the light and the fire light. There is a heat